Hi, your doctor's diagnosed you with critical limb ischemia. Your specific presentation is rest pain. Rest pain is a presentation of critical limb ischemia that patients often get at night. It's a pain in the foot that occurs and often awakes people up from a sound sleep. The reason this happens is people have multiple levels of arterial blockage somewhere between the heart and the foot. And what happens at night is your cardiac output falls a little bit, the amount of blood that your heart pumps, and that's enough to tip the scale so people develop the pain in their foot. Often they have to dangle the foot or get up and walk around to increase how much blood their heart pumps to relieve their symptoms. This presentation of rest pain is what we call a limb-threatening presentation, and that's why it's called critical limb ischemia. If we don't do something to address the blockages in the arteries, you're at significant risk for losing your limb. So what we need to do is several things to treat this problem.
Whenever you're ready.
Okay. Hi. Your doctor's diagnosed you with critical limb ischemia. Your particular presentation is a non-healing ulcer. And what this means is that you have enough blockages in the arteries in your limb that there's not enough blood getting to your foot to heal this ulcer. If we don't do something to address the blockages in the arteries in your leg, you're at significant risk of losing the entire limb. So we'll need to do some type of procedure to improve the blood flow to your foot. We'll also have to do some medical treatments to reduce your risk of stroke and heart attack as well. Hi. Your doctor's diagnosed you with critical limb ischemia. Your particular presentation is gangrene. You probably noticed the discolored areas on your foot, and that's what brought you in to see the doctor. What that discolored area represents is tissue that's no longer alive. The reason this is developed is because you have significant arterial blockages in your leg. In order to address this problem, what we'll need to do is a procedure to restore the circulation in your leg, and then we'll have to do another procedure to remove the tissue that's no longer alive. We'll have to do this in several steps. One is to institute medical management and discuss other endovascular options or open surgery to fix the blockages in the arteries in the leg.
If you could just say that last part, that would be perfect.
So what we need to do is institute medical management for the atherosclerosis, which is at the root of what the problem is. And then we'll have to do procedures possibly to restore the circulation in your leg, either with endovascular management or open bypass surgery.
Okay.
One more time without the atherosclerosis.
Okay, without the atherosclerosis. In order to take care of your problem, what we'll have to do is institute medical management and then endovascular or open surgical procedures to restore the circulation in your leg. The reason you've developed the critical limb ischemia is related to blockages in the arteries in your legs. The process that causes this is atherosclerosis, or hardening of the arteries. This process involves every artery in the body, so it also affects the arteries in the heart and in the brain. Because of this, it puts you at higher risk of stroke and heart attack. So as part of your medical management, we need to do some things to reduce your risk of these dangerous events. The risk factors for atherosclerosis are hypertension, high cholesterol, smoking, and diabetes. We're going to have to institute medical therapy to treat all these processes depending on which ones are involved in your particular case. The other thing that we'll need to do is make sure that you're on an antiplatelet agent, either aspirin or clopidogrel, which are drugs that reduce the stickiness of the platelets and do a good job to reduce the risk of stroke and heart attack.
Very good.
All right, I'm ready when you are.
As I mentioned, we're going to institute some medical management. Most of what I'm going to talk about is to reduce your risk of stroke and heart attack. The first thing we're going to do is start you on a medication, an antiplatelet agent, either aspirin or Plavix. These medicines make platelets less sticky and do a good job to reduce the risk of stroke and heart attack in the long term. The other risk factors are high cholesterol. In order to test for this, we're going to send you for a blood test. if your cholesterol is elevated, we'll start you on a medication, usually a statin, which does a good job in lowering your cholesterol level and reducing your risk of stroke and heart attack. The other major risks for atherosclerosis are hypertension, diabetes, and smoking, and we'll probably refer back to your primary care doctor to manage these. Smoking is probably the biggest controllable risk factor in the development of atherosclerosis.
Okay.
Is that better? So what we'll do now is I'll give you a prescription for the antiplatelet medicine. I'm also going to give you a prescription for some blood work so that we can measure your cholesterol and your fasting glucose. In addition, we'll also be measuring your blood pressure in the office today.
Okay.
So the next step to take care of your problem is to diagnose exactly where the blockages are in your arteries. In order to do this, we do a procedure that's called an angiogram. What the angiogram involves is putting a needle into the artery in the leg, usually at the top of the leg, called the femoral artery. Through that needle, a wire is passed into the aorta, and then over that wire, a sheath is put in. Through that sheath, we place a catheter in the aorta, and then we inject contrast dye that we look at under X-ray, and that gives us the outline of the arteries on the inside. And through this way, we can diagnose exactly where the blockages are in your artery. I wanted to pause to.
I'm rolling.
The angiogram is an outpatient procedure. Basically, you'd come in the morning, we do the angiogram. After the procedure, you need to lie flat for about 4 hours because this will reduce the amount of bruising you get in the groin where the puncture is done. You'll spend most of the day at the facility and then go home later that night. And then we'll arrange to see you in the office to go over the results of the angiogram. At the time of your angiogram, your doctor determined that the narrowings in your arteries could be treated with endovascular techniques. What this means is he could use the catheters and wires that were already inside to do the angiogram to treat the narrowings in the arteries. What was done was a wire was advanced across the lesion, and then over that wire a balloon and then a stent was placed. The balloon dilates the arteries, and then the stent is like a chicken wire tube. And what that does is maintains radial force on the artery to help keep it open. In this way, he was able to treat the narrowings in the arteries. So now what we need to do going forward is to make sure the wound heals on your foot. We'll be following you at intervals in the office. And we'll also be doing some tests to test the reconstruction that was done on your arteries. We reviewed your angiogram, and we determined that you weren't a candidate for endovascular treatment. That's treatment with the catheters and the wires. What you're going to require to improve the blood flow to your foot is an open bypass. The way this is done is we take blood from where the arteries are open and then bypass around where the blockages are to where arteries are open lower in the leg. We usually do this using a vein that's in your leg called the greater saphenous vein. What we'll be doing next is an ultrasound of your legs to find a vein where we can do this bypass. The surgery itself is done as what's called same-day surgery. You'd come in the morning of the surgery, we'd perform the operation, and then you'd stay in the hospital after that. The average length of stay for this procedure is about 5 days. The incisions you'll have on the leg usually will course along where the vein travels in the leg, which is usually down the medial side. You'll also have an incision at the top of the leg where we sew the vein to the artery that's open, and then another incision farther down on the leg where the arteries are open lower towards the foot, and we'll sew the vein there. In that way, the blood travels around where the blockages are and gets more blood to the foot to heal the wound that's on your foot. Say foot. Hi, your doctor's diagnosed you with a deep vein thrombosis. What this is a blood clot in one of the deep veins of the leg. There's two systems of veins in the leg. The superficial veins, these are the veins that people notice that become varicose. Those would be the varicose veins. That's the superficial veins. Your clot is in the deeper veins of the leg, which are deep down inside the leg by the bone. The big risk to having the deep vein thrombosis is that the clot can travel from the deep veins and end up in the lungs. This is called a pulmonary embolus, and often this produces serious clinical consequences. Usually the clot forms for one of two reasons or in combination. It can be because people have a hypercoagulable blood disorder. What this means, their blood is too thick or clots too easily. Also, it's related to stasis, which means inactivity. And that's why we often see blood clots like this in patients who are immobile, elderly, or have had some major surgery, either abdominal or orthopedic procedures. These are common situations when people can develop blood clots. Initially, when the clot forms, people often notice the first exacerbations, which are swelling in the limb, and as the limb swells, they often develop pain. This is what often brings them either to the emergency room or to see their primary care doctor. DVT, or deep vein thrombosis, is easily diagnosed with an ultrasound, which is a painless test. It allows us to look at the vein, and when the test is done, they see if they can compress the vein. If the vein can't be compressed, it means it's full of clot, and that diagnoses the deep vein thrombosis. As I mentioned previously, one of the risks of the blood clot is that it can travel to the lungs, and this is a serious problem when this does happen. So what we need to do is reduce the risk of that happening by anticoagulation. The anticoagulation is done first with an injectable medicine, heparin, which can be given through your vein or through a subcutaneous injection. This thins your blood rapidly. Then long term, we can start you on an oral medication which thins your blood called Coumadin. At the time of your ultrasound, it was noticed that the clot extended into the iliac veins, which are the veins that go up into the pelvis. In this situation, the long-term sequela can be more severe, and the patient may be left with what's called a post-phlebitic syndrome. What this means is, with the clot extending to that level, long-term they'll have significant swelling in the limb and are prone to develop ulcerations in the leg long-term. What we're talking about is 5 or 10 years down the road. In order to kind of decrease this from happening, what we do is institute what's called lytic therapy. And this is where we put a catheter inside the vein and instill a medication that actually dissolves the clot. The medication we use is called TPA, or tissue plasminogen activator. In order to do this, what we need to do is put a needle inside the vein where the clot is. We then thread a wire through that needle, and then over that wire, a catheter is placed that has multiple holes in it. This catheter is left in place throughout the length of the clot, and then the medication is instilled through that catheter. And then over 12-hour intervals, we bring you back to look and see how much of the clot has been dissolved. And then once the clot's dissolved, then we'll start the heparin and Coumadin therapy, as I mentioned previously. You'll probably be on the Coumadin for 3 to 6 months, unless we identify something in your blood that says it's hypercoagulable. Then you may require longer treatment with the Coumadin. The other thing that we'll make sure that we do is to put you in what's called compression stockings. Compression stockings are stockings that are custom made that squeeze more at the foot and a little less at the top of the leg. Usually we give stockings that go to the top of the knee. These stockings will help reduce the amount of swelling you get. Because of the clot that was in the vein inside your leg, the veins may not work as well as they used to, specifically the valves. The valves are very important in helping ladder the blood back up the leg. And often these valves don't work as well as they used to after the vein is thrombosed. And these stockings will do a lot to help improve the quality of the function of your leg long term. Your doctor's diagnosed you with renovascular hypertension, or at least this is what he suspects. The reason he suspects this is that you're requiring multiple medications to control your blood pressure. Often when people require 3 or even 4 different medications to control their blood pressures, this is one of the things that doctors think about. Now, most people don't understand that the kidneys are intimately involved with regulating your blood pressure. And what can happen is if people develop a narrowing in their renal artery, usually it can develop related to atherosclerosis, or sometimes in younger women it can be from a specific process called fibromuscular dysplasia. In either case, there's a narrowing in the renal artery. What happens then is the kidney, which receives its blood supply beyond where this narrowing is, thinks that the blood pressure is too low and starts spitting out a substance called angiotensin. And that's a natural body substance that elevates the blood pressure. Because the kidney thinks the blood pressure is low, it continually spits out this medication and elevates the patient's blood pressure. Eventually requires the 3 or 4 medications then to control the blood pressure. Since we suspect you may have renovascular hypertension, we need to do a test to diagnose this. While you're here in the office, we'll do an ultrasound to look at the kidney arteries. Sometimes this is an easy screening test to do because we can get a look at the renal arteries and see what the velocity of blood flow is inside them, and then determine whether there's a narrowing present. Sometimes due to body habitus, or sometimes after patients have eaten and things, it's difficult to get a good look with the ultrasound. In those situations, we may use another diagnostic test, like a CAT scan angiogram, where we actually get pictures of the arteries to see if a narrowing is present. The test we did demonstrated that you have a narrowing in the renal artery. To treat this, often what we can do is treat it with what's called an endovascular technique. What we'll do is, through a puncture in the groin, place a wire into the aorta, and then we use a special catheter to select out the renal artery with the narrowing. We'll then advance a small wire across the narrowing, and then through that small wire we can pass a stent that's mounted on a balloon. The stent is like a chicken wire tube, and what will happen is we'll position that directly across where the narrowing is in the renal artery. We then inflate the balloon, which also expands the stent and treats the narrowing in the artery. After the procedure, hopefully your blood pressure will decrease. It's difficult to determine exactly when that'll happen. Some people's blood pressure falls relatively quickly, but some people it takes weeks or months for them to reduce the amount of medications they need to control their blood pressure. I think there's too much else I need to say there. You're going to be having a PVR today. What this is what's called a pulse volume recording. This is a test that measures the circulation in your legs. The test is performed by putting blood pressure cuffs at each level of the leg. So there'll be one on the thigh, the calf, the ankle, and then one right across your foot. What we do is inflate these cuffs to 60 millimeters of mercury. It basically just puts a little air into the bladder of the cuff. What happens is with each beat of your heart, a certain volume of blood is pumped into each level of the leg. And as that volume of blood is pumped into the leg actually increases in size. What happens is when the leg increases in size, the pressure inside that air bladder increases, and we're able to measure the volume of blood indirectly that's pumped into each level of the leg. What this generates is a tracing that tells us the volume of blood that's pumped into the leg with each beat of the heart. Since we have the cuffs at different levels of the leg, we can tell if there's fall off in the circulation between different levels. Simply put, if you have a lot of volume pumped in, the peak on the tracing will be quite high. If the tracing is flat, it means your circulation is poor and we may need to do something. We're going to be doing an ABI today. An ABI stands for ankle brachial index. What this is a screening test to determine the quality of the circulation in your lower extremities. This test is performed by measuring the blood pressure in your arm, much like your primary care doctor does when you go for a routine medical visit. In our office, we also measure the blood pressure at the ankle. We'll do this using a Doppler, which is kind of an electronic stethoscope that allows us to listen to the blood flow at the ankle. We'll then put a blood pressure cuff on your ankle, listen for the blood flow, and then inflate the cuff till the flow in the artery goes away. This tells us what the blood pressure is at the level of the ankle. We'll then index the blood pressure in your ankle against the blood pressure we get in your arm, and it generates what's called an ankle brachial index. In a normal situation, your ankle brachial index should be greater than 1. In other words, the blood pressure in your ankle should be slightly higher than the blood pressure in your arm, or equal to it. If the blood pressure in your ankle, or the index we generate, is less than 0.9, it tells us that there's some significant narrowing in the circulation in your legs. Today you're going to have an arterial duplex exam. What this is an ultrasound test that combines standard ultrasound that gives us images of the arteries or pictures using ultrasound waves. This is combined with a Doppler probe, which is an instrument that allows us to listen to the velocity of the blood flow in the artery that we're performing the ultrasound on. The way this test is performed is some jellies placed over the area where the artery is that we want to look at. The ultrasound probe is then placed on the skin where the jelly is applied. What the jelly does is allow the sound waves to travel through the skin and to look at the artery. We then use the ultrasound in combination with the Doppler to put the Doppler probe directly in the flow stream of the artery. This allows us to measure the velocity or how fast the blood is flowing inside that artery. The faster the blood flows, the more narrowed the artery is. So if we identify a segment of the artery where the blood flow is very fast, it tells us there's a narrowing inside that artery. We'll scan the entire length of the artery to see if we can identify any potential narrowings within the blood vessel. You're going to be having a CTA. What a CTA is a CAT scan angiogram. And basically what this is a standard CAT scan which allows us to look at, normally is used to look at the organs inside your body. In this situation, what we'll be doing is injecting dye into the veins in your hand, and then we'll follow the path of that dye through the arteries in your body. And this way we can image the entire length of your arterial tree, usually limited to the abdominal segment because that's the most common area that we look at. The way this test is performed is an IV is put into your hand, and then through that the dye is injected. You're then passed through the CAT scanner relatively rapidly to collect all the images. When the doctors look at the pictures, what it looks like is you've been placed through a bread slicer and we see each segment of your body and the dye inside the artery. In this way we can determine if there's any abnormalities in the blood vessels, either dilations or narrowings, and then can plan your treatment based on this test.